In my other video, I talked about internal medicine subspecialties, what do they do and how much do they make? Click up here for that video. But now it's time to talk about other medical and surgical subspecialties. So don't go anywhere and let's dive in. Hello my friend and welcome to Chatter Docs. I'm Dr. Tor and I'm an internal medicine physician. In this channel, I believe that learning about medicine and health does not have to be boring. Don't forget to subscribe, turn on notifications, share the video, hit the like, leave comment, blah 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 blah. All the bullshit that the YouTubers tell you. In this video, I'm gonna go over other medical and surgical subspecialties in medicine and tell you what do they do, what are they known for, and how much do they make? Money, money, money. And you know what? I decided to do that from bottom to top based on the salary amount. Number 1, pediatrics. Oh, my poor pediatric fellows. They deal with kids who don't listen to you, cry all the time, and can't tell you their pain. And worst of all, are always accompanied by 2 annoying parents. It's 3 years of training and they're getting paid $221K per year. It's basically the equivalent of internal medicine but for kids. After finishing these 3 years, they can either work as a pediatrician in the office or in the hospital, or do 1 to 3 years of fellowship on cardiology, pediatric GI, endocrinology, and things like that. Number 2, public health and preventive medicine. I really don't know what they do, but they can make $237K per year. Number 3, psychiatry. It's 4 years of training. I'm not gonna say anything about this specialty because I hate it and my wife is a psychiatrist. So it's a great specialty and they can make $275K per year. After finishing psychiatry, they can do more fellowships on women's mental health, addiction, forensic psychiatry, child and adolescent psychiatry, and so forth. Next, neurology. It's 4 years of training. They deal with disorders of brain, spinal cord, or peripheral nerves. They make $290K per year, and they can do further fellowships on interventional neurology, stroke, MS, and so forth. Physical medicine and rehabilitation. They focus on rehabilitation and physical recovery of patients who lost their physical abilities due to stroke, a medical condition, trauma, accidents, etc. They usually work at the rehab centers. On average, they make $300K per year. Next, OB-GYN. OB stands for Obstetrics, which deals with pregnancy, and Gyn stands for Gynecology, which deals with disorders and conditions in female reproductive system. It's a surgical subspecialty because apart from natural vaginal delivery, they also perform cesarean sections and also surgical procedures on removing the tumors in the reproductive system and things like that. They're usually miserable and sleep deprived because they have a lot of emergencies. Also, they should carry a massive malpractice insurance because they're dealing with both the mother and the baby's health. On average, they make $312K per year. Pathology. They're doctors who hate coming in contact with patients. They grab the samples, look at the slides under their microscope, and tell other doctors what disease and conditions are they dealing with. They make $316K per year. Next is emergency medicine. They're the cowboys in the hospital. They know a little bit of everything, but basically they don't know shit about shit. They are the first doctors whom you see when you go to the emergency department. They treat your emergent conditions, stabilize you, and either discharge you or admit you to the floors. It's 3 to 4 years of residency and they can make $354K per year on average. Next, general surgery. It's 5 years of malignant residency. It focuses on surgeries of GI system or endocrine system, like the glands, or you can do fellowships on cardiothoracic surgery or vascular surgery after that. They do long hours of intense training in the hospital. That combined with the relative lower salary of $370K per year makes general surgery less popular than other surgical specialties. Anesthesiology. They basically put the patient to sleep at the beginning of the operation and then go on Instagram and TikTok and then wake the patient up at the end of the surgery. Well, of course, this is if everything goes well, but if everything does not go well, then they're screwed. They make $378K per year, and because of the high stress in their job and access to drugs, they have a high rate of drug abuse and suicide. Next is ophthalmology. 4 years of training, very high class teeny tiny surgeries on the eyes, and they make $379K per year. They can also do 1 or 2 more years of fellowship on cornea, glaucoma, retina, uveitis, etc. Dermatology. If you want to do only 3 years of mellow residency with no night calls and intense training, and work at your fancy office with your fancy patients and never go back to the hospital and make a ton of money, become a dermatologist. They make about $394K per year. and that's why it's very competitive to get into dermatology residency. Number next, radiology. They absolutely hate people and love computers. They love to be in the dark just like vampires. It's 5 years of training and they can do 1 or 2 more years of fellowship on interventional, cardiothoracic, abdominal imaging, neuroradiology, etc. On average, they make $413,000 per year. Otolaryngology. It's a fancy name for ENT or ear, nose, throat doctors. 5 years of surgical training with 1 or 2 more years of fellowships, and they make $417,000 per year. Urology. They do surgical interventions on kidneys and urogenital system. They're very comfortable with pee and they make a lot of dick jokes. It's 5 years of residency and they make $427K per year. Orthopedic Surgery. The well-built bros who do 4 years of intense surgical treatment, they make $511K per year, and they can do further fellowships in hand, elbow, shoulders, knees and toes, knees and toes. And the top on our list, of course, plastic surgeons. They do 6 years of training and on average they make $526K per year. They do a lot of cosmetic surgeries and also non-cosmetic ones like fixing a cleft palate, microsurgeries, face or hand transplant, etc. I left one surgical subspecialty out, maybe on purpose, because they have humongous egos. Can you tell me who they are? I'll give you a hint. How do you know if one of them is in the room? Well, they will tell you. They are very hardworking and have a shitty lifestyle. They have 7 years of residency. Did you get them? One more hint. The good-looking McDreamy in Grey's Anatomy. If you got what specialty it is, comment down below. You can find my other videos right here. I'll see you later.